Okay, gang, this is Dr. Grenier with A&P I. If you'll recall, this is our kidney model. We looked at it in class to look at the types of simple squamous epithelium and some locations for simple cuboidal epithelium. So when we looked at the kidney, we wanted to look specifically at these nephrons, these functional units, and we kind of wanted to go into where the nephron has the corpuscle and then shows the proximal tube, and over here it shows the distal tube. So if we can try to zoom in a little bit, this here is one of our blood vessels coming in. This is a capillary bed, and then this is the blood vessel coming out. In here, and you can't see it all that well, but this red capillary should be lined with simple squamous epithelium. And if you recall, we called the blood vessels simple squamous epithelium endothelial cells, and they line all of our vessels and our chambers of our heart. All right? So that's one example of where we can see simple squamous epithelium. Over here on the corpuscle, the outside, we know that this is going to be simple squamous epithelium, and so we create big distance for any fluid leaking out that it can collect in this little space. We also know that there's going to be some areolar connective tissue right underneath in that basement area, and then there'll be some dense kind of regular connective tissue to make a tough outer little shell here to kind of keep all of this inside this entity. Okay, as we move into the proximal tube, we know that those tubes are going to be lined with simple cuboidal cells. And you can kind of see that these are a little bit more squarish, whereas over here they were a little bit flatter. So here is an example of where we can see simple cuboidal cells. And then if we go over to this area, this is another part of the tube that is also going to show us simple cuboidal epithelial cells. So the kidney model here, we see two examples of simple squamous epithelium. We see where areolar connective tissue is kind of helping be that glue, a little dense irregular connective tissue to be tough around. We see simple cuboidal, simple cuboidal. When we go over here, again, we're looking at, there's going to be some dense kind of a mix of irregular connective tissue. Over here is going to be a very collagen-rich, and so it sometimes gets called a fibrous connective tissue. But it's a very dense connective tissue full of collagen that makes a tough outer coating. All right, so I just wanted to bring out that this is one, again, another location for some of our dense, irregular connective tissues. All right, students, have a great week. Remember, test coming up, and I hope these are good reviews for how to look at the models and how to recognize some of your specific tissue types.